The project, supporting and strengthening sub-regional post-Ebola medical surveillance and socio-economic recovery initiatives in West Africa, which is being implemented through a partnership with the Noguchi Memorial Institute for Medical Research of the University of Ghana, Legon, the West African Health Organization, and the United Nations Development Programme Regional Office with support from the Government of Japan. The Ebola virus disease was a new phenomenon in West Africa and placed a heavy burden on the three most affected countries: Guinea, Liberia, and Sierra Leone. The socio-economic impact of the Ebola virus disease outbreak is well documented. While the disease has been controlled, the risks remain, especially with the continued porous borders. This calls for continued vigilance and readiness to respond at all levels, but most importantly at the border points. The UN agencies and other development partners have continued to provide post-Ebola virus disease recovery support to address critical recovery challenges. Ahmad Michelle Brooks is the United Nations Development Programme's Regional Coordinator for the post-Ebola project.
Since the country received international support from donors and from the UN, including UNDP, we did in-depth analysis to target the local communities, and particularly those living at the cross-border, because those three countries are entities, or let's say part of a union. This union is the Mano River Union, and they share common borders, the three countries. But we strategically included the fourth country, Côte d'Ivoire, which was actually not affected by Ebola. But since it was, we had to internationally or regionally address the Ebola issues, we included these four countries to be together, to work together on addressing this AVD outbreak at the local level. This is how we involve our partners, means national partners, as well as the regional, sub-regional, and specialized institutions. So to design this project, so we receive various inputs from different parts, civil society organizations, all stakeholders that are working in the area of livelihood, social cohesion, because this project is a very innovative project.
Director of the Noguchi Memorial Institute for Medical Research highlighted the research work conducted and critical roles the institute played.
During the Ebola outbreak, the Noguchi Memorial Institute for Medical Research became the first point of call for the Ghana Health Service, because the institute does one thing, maintaining always highest level of research expertise. So the institute has many experts in various disease fields, in virology, and Ebola was a viral disease, in bacteriology, in parasitology. So really what the institute did first of all was to quickly grasp and establish the systems for detection of the Ebola virus, diagnosis of the disease, and then transferring the technologies to the personnel of the Ghana Health Service.
We were approached by UNDP, the Regional Office for West Africa, to find out if we could help the affected countries. This is stemmed from the Ebola outbreak in 2014-2015, to help in providing some of the skills and the competencies that are available in Noguchi and also in the country.
Accordingly, the Noguchi Memorial Institute for Medical Research sought out to improve regional institutions' operational capacities by organizing training to strengthen capacity of 4 ECOWAS countries, namely Côte d'Ivoire, Guinea, Liberia, and Sierra Leone, plus Ghana, to monitor diseases, especially at border districts. The training workshop program aimed at developing border districts to result in improved abilities to rapidly identify disease of public health importance and outbreak potential, to use geographical information systems for enhanced disease surveillance, and to apply tools for disease risk assessment, vulnerability mapping towards outbreak control. It was also to review risk communication for effective community interactions. We sampled views of some participants on their expectations.
First and foremost, expectation is that I would learn some new skills, some experiences that other colleagues went through when they were responding to the Ebola virus outbreak in their respective countries, and see what lessons possibly I could learn from their experiences, such that if there's any such occurrence or recurrence of Ebola or similar conditions, then I can employ some of these ideas and experiences in my own country.
Nos attentes de cet atelier, c'est un renforcement de capacité des personnes qui sont venues ici dans la surveillance épidémiologique des maladies sous surveillance, et la mise en place d'un système de détection précoce des cas de maladies, surtout dans le cadre de la surveillance animalière qui figurait dans le programme, et aussi s'outiller pour comment pérenniser les acquis pendant la période post-Ebola dans notre pays.
The workshop commenced with an opening ceremony that was graced by several high-profile dignitaries. United Nations Development Programme Country Director in Ghana, Dominic Sam, called for the need to have a holistic approach to drastically getting the continent ready for any of such outbreaks.
The Ebola outbreak in West Africa was a wake-up call to all of us. It taught us a lot of painful lessons we must never forget. In fact, the former UN Secretary General Ban Ki-moon put it succinctly when he said, "We must translate lessons learned from the Ebola outbreak into stronger national and international systems to prevent and to respond to health crises."
The 35 participants, 7 each drawn from Guinea, Liberia, Sierra Leone, Côte d'Ivoire, and Ghana, were carefully selected from the national and border district levels, and they included Health Information Management Officer, Disease Surveillance Officer, Disease Control Officer, Port Health Officer, Veterinary Officer, Clinician, and Community Health Officer. They were taken through disease surveillance in humans.
It's about early. The emphasis is on the early part, early detection. And then there's another word called report. So you can detect, but not report, because it has consequences about response.
Disease surveillance at point of entries.
Competent authorities. Who is a competent authority? Competent authority is any institution or organization mandated by the country to supervise the implementation of IHR at the points of entry.
Disease surveillance in animals.
Veterinary public health, look at what it's saying, is the sum of all contributions to the physical, mental, and social well-being of humans. We're looking at the use of animals and animal diseases as early warning systems for emerging human health emergencies and diseases.
Application of risk assessment and vulnerability mapping.
In fact, you can inspect what you expect. That is very important. So document it and then take the mitigating plans and ensure that they are ready, so that in case it comes, you are ready to address the challenges. So public health emergency preparedness and response activity must be regularly updated of their knowledge and then the necessary logistics that has to be employed.
The use of Geographical Information System, GIS, for enhanced disease surveillance, especially at the border areas.
So what GIS does is it combines the question of what with the question of where in one single interface. And the benefit behind it is simply this. Almost all of us in this room might presume that we can read and write. But it is said of many years, a picture speaks more than 1,000 words. And then we produce this visualization by way of maps. And we make use of that maps for intelligent purposes.
The application of surveillance outbreak response management and analysis systems, SORMAS, were introduced.
A system that improves the quality of surveillance. What is improvement of surveillance? Timeliness, completeness, sensitivity, predictive positive value, data quality, and flexibility. What is here says Albasu Primary Healthcare Center with what? 22 cases. Do you see that? Now, if you click it, you actually see all the EVD cases, and you can see these are confirmed cases, these are suspected cases.
Participants were presented with tablets each to help them apply tools such as the Geographical Information System and the Surveillance Outbreak Response Management and Analysis Systems, SORMAS, to enhance disease monitoring. Some participants shared their experience acquired at the workshop.
We have been able to put things in place should we have an outbreak, and that was demonstrated very recently when we had the flash floods and the mudslide in Sierra Leone. And you know, in the event of mudslides and flood, the most likely occurrence that we would expect is cholera or other waterborne or water-wash diseases. But since then, we are able to contain the situation. As I'm talking to you now, we've not got any outbreak.
The mode of presentation was really very simple and to the point. Even the materials, we are really up to date because we could see that because we are also medical doctors, we have been reading some epidemiological or surveillance handouts from the CDC, the WHO. We could see that really they were up to date and very simple to understand.
Il ne faudrait plus qu'on se laisse surprendre par une situation malheureuse, par une épidémie. Il faut que toutes les structures qui permettent d'être réactifs, détecter précocement, toutes ces dispositions soient mises en place. Réactiver les comités de lutte contre les épidémies au niveau régional, au niveau départemental, au niveau des sous-préfectures et même au niveau des villages. On l'a fait pendant Ebola, mais il faut réactiver ces différents comités pour qu'on ne soit pas surpris. Il faut qu'on reste vigilant.
It was a very nice idea to get the teams from the Ivory Coast to also come, in the sense that when the knowledge of the parties are not at the same level, sometimes there are misunderstandings. Some things need to be done. So when all of them have been trained together, it means that they are all on the same communication level. Everybody knows what he or she has to do.
With a testimonial from most of the participants, one can attest to the fact that the objectives set for the workshop was satisfactory and will ensure that the socio-economic recovery initiatives are implemented to curtail such an outbreak in future. Certificates were awarded to all the participating countries.
They are supposed to go and share whatever information with their colleagues and ensure that they put in structures that will ensure that preventive risk communication is an ongoing thing. The best time to prepare for an outbreak is when there's no outbreak. That is a major statement. You don't wait till there's an outbreak, then you are caught pants down.
And we hope that they will understand the linkages that they must follow or must enforce in their routine translation of information to the national level. And in line with international health regulations, share this information, with other countries to enable a more effective response, learning on our experiences from what happened with the Ebola outbreak in West Africa.
Director of Public Health at the Ghana Health Service, Dr. Bedu Sarkodie, also alluded to the fact that capacity needed to be strengthened with early detection, which was a challenge on the continent.
For most of public health emergencies, late detection is a very big challenge, and when you do that, you end up chasing the outbreak or the emergency rather than facing it. So we need to strengthen capacity at all levels to pick emergencies early, and as soon as you pick it, you don't just rest on it or over it. The necessary response mechanisms that need to be activated should be activated as soon as possible for us to contain the situation from source.
The Japanese ambassador to Ghana, Kaoru Yoshimura, spoke about the reasons for which the government of Japan funded the project.
Of course, health sector is one of the prioritized area of our development support. At the same time, when we look at the huge impact of the Ebola outbreak, we need to carry out other projects to support the recovery of those countries suffered from Ebola outbreak.
Well equipped for further outbreaks in their respective regions on the continent, these participants bid farewell and assured of becoming disciples of what they had acquired. This project was funded by the government of Japan and with support from the United Nations Development Programme and the Noguchi Memorial Institute for Medical Research of the University of Ghana, Lagos.